I've been made and sealed with love, but time to battle, I'll fight them all. I felt the whips and remember chains, but my sword has been forged by my father's flames. Fight your fears and heal your pain, and victory will be in your name. I used to be weak, but I'm not weak no more. I found the strength of my ancestors deep down in my African core. I used to be frightened, I'm not afraid no more. The Father blessed me with the heart of a lion and a warrior soul. So no weapon that form against I shall not prevail. No man that rise against I, that war they shall never win. 'Cause I will conquer, no I will conquer. Yes I will conquer, conquer. No man let's conquer, no I will conquer. Rise up and conquer, conquer them. Tell them no retreat, no surrender. I shall fight till the end of days. I was born as a Makai warrior, and the Almighty God my blade. Fire burn as Satan carrier. Father loose all shackles and chain. This morning first thing as I wake up, King David told Sam to the brain. Don't let your courage go down, keep it up. And if your heart rip up and stitch it up, don't let your faith them fall, pick it up. When the cup was empty, God fill it up. Don't take the devil contra, rip it up. And if your bad mind people to commit it up, pass me the Congo drum and let me beat it up. God on my side, me no give it up. No weapon that form against I shall not prevail. No man that rise against I, that war they shall never win. 'Cause I will conquer, no I will conquer. Yes I will conquer, conquer them. No man let's conquer, no I will conquer. Rise up and conquer, conquer them. Thank you, Father. I want to say thank you, everything, Father. Father, you alone shall guide me. No man shall lead my path. In the wind I hear your quiet whispers, and you heal my broken heart. Even some of my friends turn enemies, and they pray for right to fail. I remember you gave us your only begotten son, but we gave him the word of grace. Send down your warriors with the hello. They carry down to the end of days. No matter how the devil try trick me, unto you my soul I will give. Father, I know this time is coming. I can see the high tide raise. Without you there is no other. Could there be that really myself? Weapon that form against I shall not prevail. No man that rise against I, that war they shall never win. 'Cause I will conquer, no I will conquer. Yes I will conquer, conquer them. No man let's conquer, no I will conquer. Rise up and conquer, conquer them. I am a champion, I am a warrior. So who are you to tell me that I cannot make? Who are you to tell me that I am not the greatest thing that God ever created?
Good morning, good morning, good morning, Grenada, Carriacou, and PD Martinique. You are listening to Hard Talk Grenada. A special good morning to those of you joining us on 97.5 CitysoundFM, 89.5 CRFM, 92.9 Sister Radio broadcasting from Hillsborough, Carriacou, and of course 94.9 WeiVybz Radio out there in Brooklyn, New York. A very special good morning to those of you joining us on the live video, whether it is on Facebook, on YouTube, whatever it may be. We thank you for joining us. All right. Of course, it is Monday. It is a new week. It is a beautiful, beautiful day. But of course, we must continue the conversation as it relates to the coronavirus. Keeping you updated, of course, is our duty. So we want to make sure that you have all the facts, that you have all the information, and that you let wisdom lead in all of your decisions. And with me in studio this morning, I have none other than Miss Doctor, that is Dr. George Mitchell. And he is the COVID-19 coordinator for us here in Grenada. So he's handling all our COVID business. Good morning, Dr. Mitchell.
Good morning to you and good morning to your wide listenership
Yes.
out there, wherever they are.
All right. Now, I usually start off by giving the people the updates. So I hope you'd
Okay.
oblige me. Let me quickly do that. So as of this morning, we are at 111,646 cases or reported cases of the coronavirus. Of that, we have 3,884 deaths and 62,683 recoveries. But remember, we told you that the number we're really looking at, all right? I know 111,000 sounds like a big number, but the number that we're really looking at is that 45,000 active cases. That's really the number that we want to pay attention to. So that means that there are 45,000 people worldwide that are still with symptoms of or still being affected by symptoms of the coronavirus. All right. And there are 110 countries and territories as of yesterday, and one international conveyance that is experiencing or has people experiencing symptoms or cases of the coronavirus. So we want to take that into consideration. Of course, we know that over the weekend, yesterday to be exact, Italy would have put in place some really stringent measures for their people, emergency measures, advising their people that there will be no travel in and out of the areas that they have on lockdown, right? They have 16 million Italians living in 14 provinces, right? That is currently on lockdown, all right? And that, of course, is in an effort to basically manage the transmission of the virus, all right? They also advised that people with symptoms of respiratory disease and fever, 37.5 degrees Celsius or above, are strongly encouraged to stay at home and limit social contacts as much as possible. And of course, contact your doctor, which is what we have been advising here for from the onset, you know. Of course, avoid gathering. All schools and universities are closed. All museums and places of culture will be closed. All cultural, religious, and festive events have been suspended. Cinemas, pubs, theaters, dance schools, game rooms, casinos, nightclubs, and other similar places shall remain closed. And of course, all sporting events and competitions suspended. And that the list goes on of the restrictions that they have in place for these emergency measures. All right? So you definitely want to be mindful of that. 110 territories. And we're looking at, let me just give you the top 6 or 7 of them. We have China, who seems to be getting quite a handle on controlling the spread of this virus, who yesterday, I believe it was, they only reported, Dr. Mitchell, 1 new case and 0 deaths. That was yesterday. But of course, you have the virus progressing in people,
And other
from time to
territories.
time.
Yep.
So we have 44 new cases in China with 23 new deaths. Now, this is significantly lower than when they had initially found that there was a problem.
During the outbreak, during the initial stages of the outbreak.
Right? And then we have South Korea, who is now at 7,478 total cases, Italy at 7,375, Iran at 7,161, France 1,209, Germany 1,151, Spain at 1,036, and the USA at 566 cases. All right, and that's just to name a few. So we definitely want to encourage you guys to keep up to date and abreast with what's happening internationally, because it definitely helps us here as well. All right, so we have Dr. Mitchell here with us.
Thank you for having me, of course.
And today what we're really going to be focusing on, I know there's been a lot of talk. We've spent the past 2 weeks trying to put out fires and rumors and propaganda. And I think it's now time for us to really sit down and talk about process and procedure. Because this is important. I mean, we mention process and procedure here and there. And I think it gets overshadowed by the amount of propaganda and falsities that's circulating. So I think it's important for us to really focus on process, procedure. What do we do? Let's take it from the beginning right up to the end product, because there are a lot of people that are still saying that we're not ready.
Okay.
And one of the questions that I really want you to address later on is, if we are not ready, what more really can we do? I know we're telling the general population, these are the measures that you need to follow to decrease the chances of widespread infection. But in terms of the Ministry of Health and government, what more can be done? And that's something that we're going to talk about later on.
Okay.
But what I really want us to focus on right now is process. All right? So let's take, for example, I'm coming into the country today from one of our affected areas. What is the process, Dr. Mitchell?
So let me begin by sort of like contextualizing my role
Yes.
in this whole thingy. The Ministry of Health, of course, is the lead agency confronting the COVID-19 virus.
Right.
And let's not forget that, this is an extremely audacious, if you want to call it, a job to do, task to do, consuming a lot of energy resources. And there are other aspects of the ministry and work in general, as per everybody, that has to be done. Therefore, it is sort of like against this background and the fact that as the recent chief medical officer, I was occupied that position for a few years, well enough until the end of October last year. And during that period that I occupied the pivotal posts in terms of the ministry, I have had the experience of responding or leading the response to chikungunya, preparations for Ebola, and Zika in 2016. So I sort of like coming with that kind of background.
Right.
And what has happened in this case is that with all that's happening, with all the frenzy that is happening out there, all the information and misinformation that is happening out there, I think the Ministry of Health and indeed the government has seen it fit to ask me to come and help coordinate the response. So that is why some people joke around and say, I'm the czar, coronavirus czar, that kind of stuff like that. But my official title, of course, is COVID-19 coordinator. So I'm just here to streamline, to focus, as you were saying,
Right.
the efforts in terms of our national response. And we've been doing, and Grenada has been doing a lot. And what I want to basically streamline here, and what I've done is to basically, as I say, package the response, and it has been mainly along 5 strategic lines.
Right.
And I will enunciate them now. Our 5 strategic lines are as follows. 1, massive public education and awareness building. We think that is of utmost and critical importance, because the fact is that this virus is new, it's novel, and so there is a lot of information going out there. Some are correct, some are way, way, way out on left field.
Right.
Some have created panic. It's really, really, really that kind of hype. And a lot of it has been due to misinformation going out there that has made the public respond in a frenzy manner. So much. So we have decided that this is a critical aspect of our response, sharing the correct information and making sure that persons basically know about the virus. It is, as with everything else, it is the unknown that drives fear. If you don't know something, if you don't know about it, you get really frightened. And this happens in everyday life. You're going on an aircraft for the first time, you're going and do something for the first time, it is that fear. So one, we have decided to ramp up our public education. In so doing, we would focus on schools, more on schools. So we have the Ministry of Education as a strategic partner to ensure that all schools get the pertinent information about what to do, how to do it, when to do it, etc. Our focus would be on the workplaces. We are currently and would continue to engage the workers' unions, Chamber of Commerce, the churches, and I'm not sure if you're aware that the churches have already jumped on board in a big way. Yesterday, they distributed at the churches pamphlets, and the talk was on Corona. How do we, as a congregation, how do persons, confront it? So we are building awareness and so that persons can do the right thing. Our second strategic objective in confronting the coronavirus is trying to prevent as much as we can. In other words, surveillance and monitoring. So I think this sort of like falls into the camp of where you were asking me, what happens if someone comes in? Now, we have like many other countries issue travel advice on particular countries. And thus far, I think it's about 6 or 7 countries. China, of course, where the outbreak was, Italy, Singapore, Korea, Iran, those countries where we've had what we call community or active transmission. So those countries, we have said, okay, if you're coming from those countries, if you're thinking about coming, kind of be aware that you will be quarantined. And we have quarantined up to 19 persons, as far as I know, up to this point. And we have allowed a few of them who have made their mandated 14 days, asymptomatic, no symptoms, we have said you can go home. Those who decided that they would go back, there are a couple of persons who decided, okay, all right, I'm not going to sit down in Grenada for the 14 days. We have said, okay, no problem, you can go back. Those, of course, not showing any symptoms. So, yes, we have a robust process, and that process is ably assisted by by the Immigration Department. That has an advanced passenger list, so we know where people are coming from. We know their identities. And we, to an extent, we know their travel history. So before they actually land, we're actually, in possession of that information. So that has been a fantastic job that the ministry is doing and continues to do. The same goes out for the cruise line. So we have had meetings with the cruise industry, the agents, and even at the regional level, there's been important meetings happening to ensure that the cruise liners do the right thing.
Right.
What is the right thing? Declaring their passenger and crew, and particularly if there are sick people on board.
Right.
So that information should be provided for our authorities to ensure that what is happening on the boat, that we're aware of it.
Right.
And of course, as per usual, our port health demands that we see that list, that our port health officer board the ship, ensure that what is happening or what is said on the list is actually happening. So we have that in place, and that has been, as I said, a fantastic response thus far.
Okay.
Our third strategic line is the question of building partnership and stakeholder involvement. The Ministry of Health, of course, is the lead agency, but this is a big issue, and we believe that building strategic partnership, getting all the players on board, is the way to go.
Right.
So we have been reaching out, to all and sundry. We've reached out to all the ministries, as I said, the schools, the trade union movement. We're going to be having more and more involvement. I have been giving discussions or talks at different workplaces, trying to build that consensus. We have met several times on the airport to reassure and to get people's commitment. So, for example, at the meeting on Friday at the airport, all the airline industry representatives were there, airport management, and all categories of workers were represented.
Right.
In other words, how do you ensure that you minimize possible transmission, and what do you do in terms of adherence to protocols, etc.?
Right.
So we're building that consensus as we speak. Earlier this week as well, I had a very instructive meeting with the hotel industry, the GTA, Grenada Tourism Authority, and they brought all the stakeholders together so that we're on the same page, sharing information, making sure that they can do or they do what they can in their neck of the woods.
Right.
Our fourth strategic objective is to try as best as we can to protect the most vulnerable among us.
Yeah.
This virus is new, and the data coming out is showing that it disproportionately affects persons whose immune system is battered, is weak. So persons with chronic conditions, chronic respiratory conditions, pneumonias, collapsed lungs, persons with cardiovascular diseases, heart failure, persons who are not experiencing that kind of health, persons with kidney failure, persons with cancer, persons who are not enjoying the optimum amount of health. We have decided that, okay, we will try our utmost best to get them to a stage where they can possibly withstand the virus, possibly. If you're really sick and frail, there is not much medicine I could do, not only in Grenada but anywhere in the world. To get you back to optimum health. So we have decided that we're gonna ensure that we have a visit to these special homes. We have a responsibility to our seniors. We're going to have our physicians go out there, check them, and whatever they can do to bring them to a state of health that is better than they're currently having, that we're trying to do that. We are also aware that not everybody in Grenada, not every elderly person is in one of those homes.
Right.
There are a lot of people at home that people are caring for as well. So we have a meeting with our community doctors and nurses. We had one last week with the doctors. We're going to have with the nurses to see how best we can ramp up the visits. And we are calling on persons who have sick people at home to visit those centers and tell our healthcare providers
That you have someone
that,
sick.
yeah, let's see what we can do for them
Right.
in the current situation.
Right.
So we're trying to, as I said, focus on the vulnerable.
Right.
And the fifth strategic objective is basically to build our internal capacity to deal with the eventuality of the disease. In other words, healthcare providers ensuring that they have the information, ensuring that they have as much as possible, they know what to do in terms of the protective wear, etc. And that is on one hand. And on the other hand, building our capacity in terms of physical capacity, meaning ventilators and that kind of thing, to be able to care for those who succumb and those who need that kind of care. So those are our 5 strategic lines, and under each of them we're doing several things to ensure that we are in the best possible situation to confront the virus when, I would like to say when it comes here. In other words, I am not laying back and say that it would not come here. People joke about it and all of that.
To hear when we say
No,
when.
but listen, it is now in 110 countries, as you reported. We're doing our best to try and keep it away. But don't forget, there is transmission in the U.S. right now.
Yeah.
Did you quote about 500 and something cases, 66
Yeah.
cases? Yeah, it's happening. And the diaspora out there, virtually tens of thousands of Grenadians and other nationalities live in those countries. So we have plane loads of people coming on a daily basis.
Yep.
Who knows, it might be a Grenadian who is coming from one of those cities that would, in my view, most probably bring the virus. They are healthy, they don't feel sick or anything like that. They're coming home to a planned vacation they've planned months before. You've been in touch because there is, amount of spread out there. You've been in touch with someone. You feel basically okay, and you come home, and days after, you start feeling sick. By that time, of course, you're spreading the virus among your household. So, I am not too worried about the countries that we have identified. The 6 or so countries that we have identified, because we have those people under surveillance.
Right.
And we are quarantining those persons. But, as I said, because of the number of countries now, including the good old United States, where you have transmission, it is almost impossible. Almost impossible.
Well, from what I understand, while we are taking a lot of measures here, there are countries who aren't taking measures the way we are in the region itself. And one of my biggest concerns is, and I've been saying this from the beginning, is that you cannot say just shut down all of the borders, because we may shut our borders to the international countries that are affected. But let's take, for example, our neighboring Barbados, who doesn't have these travel restrictions in place the way we do. And there's a possibility that our first case could come from the region.
Via Liat. Yeah.
It's a scary thing to think about, but it's the reality of the situation.
And it is almost a recognition, don't forget. It's a recognition by public health experts, those who are now taking as stringent measures as we are, that the virus is eventually going to come no matter what you do. Because people, you cannot say, okay, there is no travel at all in the world. That is an impossibility. And so I think what is happening is that we're really buying time and putting our systems in place to be able to to be in the best position when the virus reaches here, to be able to deal with it.
Yeah, and I want to read something that would have happened over the weekend. It's actually a press release, And it says diplomats visiting Grenada this week have commended the actions being taken at the ports of entry to help prevent the introduction of the novel coronavirus to the country. Although they represented different countries and institutions and had separate meetings with the Prime Minister, the diplomats seemed to share a unanimous view when they spoke of the port health, screening, and surveillance measures being implemented in Grenada. Pan American Health Organization, World Health Organization representative, Barbados and Eastern Caribbean countries. I think it's Gerbre or the doctor.
The Paho, yeah.
Yes,
Gibre, yeah.
the head of a delegation of the European Union to Barbados, the Eastern Caribbean states, OECS, CARICOM ambassador, Miss Daniela. Well, these are some kind of names. And the ambassador to the Federal Republic of Germany, all confirmed having to go through the requisite screening at the port of entry. The diplomats detailed the screening process they went through on arrival and commended the frontline staff for maintaining established procedures regardless of the stature of the visitors. The visiting officials said that they were impressed with the measures and the fact that diplomats are also being screened illustrates that proper due diligence is being done. And I felt like I needed to read that because here we are with diplomats from different international countries, not our Grenadian health officials, not our regional health officials, but international countries saying, thumbs up, you guys are doing a great job.
So this falls into strategy number 2, our monitoring and surveillance. And
Right.
as I said, I think the guys have done a fantastic job at ensuring that, persons of interest, as we call them, are appropriately dealt with, and in a very nice and humane way. I think this is also what the diplomats are saying. In other words, we explain to you why we are taking the measures, and 99 point whatever percent have understood and have commended what we do. So this is one very, very strong area that we have been dealing with and continues to deal with. Now, on this same monitoring and surveillance, at one of my other meetings, the issue came up about the many yachts that ply our shores.
Right.
And happy am I to announce that we have not sort of like totally or forgotten that area at all. So immigration, the hierarchy of immigration and customs met already and came up with a methodology to best manage that group of persons.
Right.
And measures are going to be implemented very, very shortly. I spoke to Superintendent Joseph, who is head of immigration, in recent times over the weekend, and those measures, what they're actually going to be implementing is that we streamline the port of calls for all yachts.
Okay.
So that the agreement is, and that would be as published, of course, is that all yachts are going to be coming into 2 ports in Grenada, first and foremost. Of course, one in Grenada and one in Carriacou.
Right.
And once you register there, once we are satisfied that you're not a person of interest, in other words, you didn't come from a country where you have active transmission, etc., we will then say, okay, you are free to go to the other ports where you normally would go, to Woburn or Prickly Bay or Lassages or wherever it is. So that is a measure that I really liked, that is going to come into being, and that is going to happen. simply because I remember very, very vividly that during our Chick-V outbreak in 2014, that basically, this is what happened. Someone from Martinique came down the islands, and the first case that we knew about was in Wynwood, in Carriacou. That was the first introduction, and it came via that means.
Right.
That was our index case.
Right.
So we know about how these things can be transmitted, and so I like the fact that we have proactively decided, okay, listen, you're going to go one here and one in Grenada, so we actually know what's happening.
Right.
And, well, the rest is history. After Carriacou, it was down on the off-spray, et cetera, et cetera, et cetera.
Now, take me through a scenario, because I like scenarios, and I think people benefit a lot from scenarios. So I wake up one morning with a fever and a cough, and match symptoms of the COVID-19.
Right.
I live in St. Patrick. What do I do?
Let's not forget that the symptoms of COVID-19 is that of almost any other influenza or viral illness.
Right.
I don't want us to lose sight of that at all.
Right.
That is paramount. In other words, headache, fever, cough, sore throat, malaise, that's feeling unwell, feeling weak kind of thing, those are the principal symptoms. Now, if you wake up in in St. Patrick's, in Madays, or wherever tomorrow morning, feeling that you have flu-like symptoms, the most important thing is going to be to try and ascertain where did you go? I mean, if you're thinking COVID, the fact is that as far as I know, we have no COVID in Grenada.
Right.
So if you wake up in the morning and you're having symptoms, it's more than like it's not COVID,
It's not
right?
But let's say we do have
So if we do have community transmission,
right.
in other words,
Which
if
is
it's
different.
totally different. If we have cases happening in Grenada and you wake up a feeling as though you have it because you're probably being in contact with someone who may have been displaying symptoms or not, what we're asking you is basically, we have hotlines. We're asking you to stay home and to call.
Right.
Right? In an effort to sort of contain the transmission. Because if you run to the health center, more than likely you're coughing, you're sneezing, blah, blah, blah.
Right.
You may be able, the risk of transmitting the condition to more persons is likely to happen.
Right.
Right? Obviously, and maybe it's the opportunity here to speak to what we now know about the virus.
Right.
In the sense of what proportions of persons that are being affected and how they are being affected. So as far as the information that we have from the experts go, it's about 80% of persons that get the disease have only mild symptoms.
Right.
You may have a little headache, you may have a little fever, you may feel unwell for a little bit, last for hours, a day or two or less, and you recover.
Right.
So the vast majority of persons, right, and that is what we have not focused on that worldwide in the worldwide conversation. I don't think that I'm hearing that enough. No, what we're hearing about those who have tested positive. Not everyone that has a little cold and fever, even in the countries that we're talking about, are going to get tested.
Right.
You know?
Right.
So
Yeah.
the numbers that we're talking about or we've been given, I am of the view that we have much more of that happening out there.
Right.
What we've been told is what we know, those who are being tested. right? So we're trying to, and this is what is being done in Italy right now. We're trying to ensure that the transmission is kept to the most minimum possible.
Right.
So if you are home and you have some symptoms of the cold and we have transmission going on here, we're asking you to take the measures that you have taken in previous influenza cases.
Right.
You try and stay as healthy as you possibly can. You drink water, fluids. If you have a cold and fever, you take paracetamol. You try and isolate yourself
Right.
from those in the house. The cases that would sort of like interest us the most are the cases that, okay, you have a mild, but then you start having shortness of breath. You start feeling really unwell.
Right.
You know, instead of breathing 12 times a minute, it's your normal, when you have short breath as a person. Yeah? If that starts happening to you, then and there you really need to inform, get up and then we would respond.
Okay.
Right?
Now, when I call the hotline, someone answers and they advise what I should do. Now, from what I understand, in each of the parish, if not every parish, there have been established medical stations with separate entries for persons who are suspected to have, and this, of course, is in the event that we have a case. So right now we don't have any cases, and there's a really bad flu going around. So if you get up in the morning and you have a headache and a fever, it's definitely not cool.
And it's been going around for months. For months. About 2 months, 3 months ago, it's like, I'm a practicing physician.
Right.
And, folks would come in and say to me, Doc, that cold real bad.
It is.
In our parlance, Doc, that cold real bad. It is my view that maybe that particular influenza virus, its symptomology maybe more than what we're going to experience with COVID. I am not 100% sure. But let me speak to that further. I mean, the current influenza outbreak in the United States, based on CDC, Center for Disease Control, the most official, respected public health agency in the U.S., if not the world, has reported as of 2 weeks ago that the current influenza outbreak has killed over 10,000 persons in the U.S. and infected over 40 million. That was like about 2 weeks ago. So
Right.
the numbers would have escalated since then. Right? The current outbreak. 40 million and more. COVID is not dreaming to reach those numbers yet. And so we wanna stay calm and focus our efforts where it is most needed. In other words, what this virus is doing, as far as we know, who it's attacking, who the persons who are succumbing to that particular virus, and hence our strategic line number 4, to try and assist those persons who are in a vulnerable state to be in the best position that they possibly can. And mind you, as I told the police hierarchy this morning, and I mentioned that at the meeting last week as well, more than likely is one of us, a healthy carrier, that would bring the virus, as has happened in the U.S., to that home or that special place, or at home to our grandaunt or grandmother or auntie or granddad. One of us, a healthy person who the virus is not sort of like causing much problems with, is going to bring the virus. So we want to be careful. If we do have the virus, then we try and do everything physically and humanly possible not to spread it by doing the right things. How is the virus spread? As far as we know, as far as the information out there, is that the virus is spread by droplets of saliva, by coming into close contact with folks, and these droplets entering your mouth, nose. There is talk about the eyes. I am not 100% sure about that, right? But that and that the surface and that the virus can live on surfaces for a particular time. I don't know. I am not the scientist for how long. But so we want to make sure that the issue of hygiene that we've been speaking about all the time, washing your hands, ensuring that you do it, you take the time off to wash for 15, 20 seconds, is crucially important in terms of trying to break the transmission cycle. And that when you cough and you sneeze, you do that in your own space for you alone.
Yeah.
Yeah? And if you do have to use a piece of tissue or so, discard it appropriately.
Now, we're going to continue the conversation, but of course, we want to open the line to take a few calls. Remember, the number to call is 440-7377 for local calls. If you're in the diaspora and you have a question, 347-329-3101. We're asking that you keep your questions direct and to the point so that other people can have an opportunity to ask one of their pertinent questions as well. But we're going back to the stations that have been established, and this is outside of the quarantine point, right? I always tell people when they ask, well, where is this quarantine station? I said, would it make a difference if you know where it is? It's not like you have to be quarantined. Just know that it's in place, trust that it's in place. And there are people who can speak to the fact that it's in place. You don't hear the people who have been quarantined, because there have been several Grenadian nationals who have been quarantined.
Absolutely.
I know of a particular government official that's been quarantined.
Yes.
You understand?
Yes,
I
yes.
have friends that have been quarantined. I know I have a family member that's coming in very soon that has to be quarantined, and preparing yourself for it. But they don't go around saying, okay, well, the quarantine site is there, because they understand the importance.
I don't see the value of knowing where this quarantine
knowing where it is. But I mean,
the fact is that facilities exist.
That it exists.
It's not one facility, and we have capacity to surge that should the need arise.
So I want us to emphasize that, because people are of the impression that the 4 beds that when we had initially spoken about the quarantine centers, we had mentioned 4 rooms being prepared.
Right.
That was the initial setup.
Let's clarify that. The 4 beds. There's been misinformation out there. The 4 beds does not speak to quarantine. The 4 beds that were prepared speak to isolation for sick persons. The quarantine facilities are for persons of what we call interest, who are coming from areas where you have community transmission. People who are not sick, people who are not demonstrating symptoms. That is quarantine, and that is what we have been doing. And mind you, let me just add here, what we're doing a lot and too much, and it's costing the government. Did I say too much? I don't mean it. We're doing what we can do, and we're pushing the envelope. The cost to quarantine one person, on average, for the 14 days, because we're feeding them and all of that too, right? It's been about $9,500.
Oh, wow.
It's a lot of money. And we've been using our facilities, right? So it costs. But I hasten to say that WHO, the World Health Organization, they have recommended home quarantine. But not everybody has the facility. And out of an abundance of caution, we are asking persons, even Grenadians, who may not have the facility, and as I said, out of an abundance of caution, we're quarantined, we're holding you.
Right.
But WHO has advocated for home quarantine and isolation. Well, isolation, as I said, let's not confuse the terminology. We're isolating people who are sick, quarantine persons who are of interest, who may have been in areas where you have active transmission.
Right.
To try and stay by yourself, do what you have to do for the 14 days to elapse.
Right.
So that's the difference.
We have isolation for people who are sick, and they might be part of the 80% that will recover. But then we also have isolation for people who are really sick and need hospital care.
Now, repeat your question. I don't think.
Do we have we have isolation for people who are who may be sick, right?
No. The isolation facility, yeah, is for persons who are sick, who
Okay.
have COVID-19
Right.
and require some form of active medical intervention.
Right.
That is isolation.
Right.
Quarantine is for persons who we suspect may
Right.
have the virus because they came from an area where you have active transmission. So let's get those concepts absolutely clear.
Right. But I think what I'm trying to ask is there is isolation also for people who would contract the virus but need hospital care as well. So is it two separate kinds of isolation for the those who might be part of the 80% that would not need the hospital care but would need some form of isolation because they are not able to provide that for themselves?
No, the 80% of persons who have a mild viral, symptoms, those are going to be persons at home.
Okay.
There is nowhere in the world, yeah, can you accommodate 80% of those who are coming down with a particular virus in an institution.
Right.
There's nowhere in the world that can do that.
Right.
Those persons, don't forget, I said that the viral outbreak in the U.S., yeah, the current influenza has affected 40 million. Is there any institutions anywhere in the world that can, house? No.
So I guess
Impossible.
the key here for everyone is being responsible.
Absolutely. Now, as I said, that 80% would have mild symptoms, headache, fever, blah, blah, blah. In the next day or two, you recover. Yeah?
Right.
But we're asking you in terms of if you think, and as I said, if there is spread, we're asking you to be responsible and stay, don't transmit it, right? To your particularly to your elderlies and persons who are sick and
We
vulnerable.
have a first call on the line. Good morning, caller.
Good morning, Miss Duncan.
Hi, good morning, Miss Cammy. How are
And
you?
good morning to your guest.
Morning, Kami.
Yes, good morning. I'm here listening to y'all. Miss Duncan, my question this morning is that we're talking about the virus out there, and I listen to BBC, I listen to CNN, and America and Rome and all these places where they close schools, children cannot go to school. A doctor in New York, a lawyer, got sick, and they don't even know how he get that disease, his wife, his family. Do you think that, we have so much of visitors coming into Grenada, think we should have a little more concern about our people here, with so much of visitors coming in here, and God forbid that it end up in Grenada. What do you think will happen? Those in authority, because we have tourists coming, we have people coming in on plane, we have people coming in on yacht, and God forbid something happens, Miss Duncan, and to your guests, that we should have a little more concern about our people here. America, what is America? And them big countries that they stopping boats, they're telling you don't want and the boats and them tourist boats. And we have so much people coming. If we're not concerned about our people, little Grenada. I am not scared. But what about the elderly people? Because I hear a doctor said, and good morning, America, we are concerned about the elderly people. We are attacking these people here. So we must do a little more study and examine ourselves and be a little more concerned about the flow of traffic and boats and planes and yachts. We must do a little more concerned about that. That's my question this morning for those in authority, the Ministry of Health and others that say they put it taking place. Because we never know. When America sneezes, we are scared to call. And they cannot find, they can't already do research for medication, they can't find that. Yet, you know that, and people scared. And they up all night listening to BBC News. And all over the world now, 100 and almost 1,000 people die. So we must do a little more studying about our people in Grenada. Have a good day, man.
All right.
And good morning to Mr. Watt and Mr. Deputy and everybody that is listening in England and Canada. Good morning. Grenada is shining bright today. Have a blessed day.
You too, Miss Cammy. All right, let me first clarify one thing that she said. It's not 100 and something thousand people died. We only have, and I say only in the context of when compared to the amount of infections we've had. We've had 3,888 deaths. This is worldwide. So from 110 territories being affected, with 111,753 infections, we've only had 3,888 deaths.
That 111,000 is what we know.
Is what we know.
Yeah.
Because there may be people at home.
Public health wise, I am absolutely sure that those are cases that are tested, but there are lots of persons who have contracted the virus and did not even go to get tested.
Yeah.
Oh, absolutely. But let me address Kami's concern, and I hope Kami was listening, because I think I addressed most of her concerns there. We are aware that we have a large cruise ship industry, and for Kami's information and for the listenership out there, as recently as yesterday, we decided that the Costa Mágica, that ship, was not going to berth here, and we have in the past few weeks actually turned back a couple cruise ship,
Right.
from berthing here, because we are not sure of what is happening on board. But suffice to say, and I said it earlier, that we have spoken to the cruise ship industry. They are a partner as well in this response. For the cruise liners, they don't want their whole ship and passengers coming down with this as well.
Right.
So they have put systems in place. They have told persons who are booked, etc., that if you have that, or if you're coming from those areas, then don't come aboard.
Right.
They have done that.
Right.
And what is happening is that we are getting what we call the advanced passenger and crew state of health on the boat. Every cruise line knows that they have to do it, and so we have ramped up the fact that they need to give us that before they can be allowed or will be allowed to dock here, so that the liners and the tourists that you see here are being checked before anyone could come off those ships. Likewise, as I said, with the airline industry, they are proactive as well, and those are persons that are coming from areas, and I repeat, areas that we consider to be high-risk areas.
Right.
Those are being checked and quarantined accordingly.
Now, something that's very important to note, and I think it's something that you would have mentioned that we don't understand, which is the logistics. So, as you mentioned, to quarantine one person for the 14 days costs $9,000.
Around $9,500.
Right. Now, that's a lot of money.
Yes.
And when you're looking at, in the grand scheme of things, because we cannot, I mean, it sounds good theoretically. It sounds easy. Let's shut down our ports. Let's close tourists from coming to Grenada. It sounds good. But practically, it's not a wise decision.
And that is why when you said that some countries are taking less stringent measures, it is on that grand scheme of things. It is a costly exercise to shut down, to quarantine persons, etc. And they thought that no matter what you do, if that thing spreads, then it's going to reach your shore, as I said earlier on, maybe by one of your cousins, your sisters, your brothers, your auntie,
Yeah.
that is coming in,
Yeah.
from one of those areas. So yes, we're doing as much as we possibly can to prevent the introduction, but we also have to prepare, and that is why we keep saying the whole issue of transmission, of taking care of, doing the right things to influence the no transmission, and to take care of the elderly population is key for us. So Kami repeated what I said earlier on about our emphasis on trying to safeguard and trying to bring that subpopulation to as optimum a health as we possibly
So
can.
let's get to the big question. Now, this is a question I really need answers on. People are saying enough is not being done. We've just gone through the ringer. We've gone through the processes, and we haven't even touched on some of the processes, such as the call ahead to a health center. What health centers do you go through? Because there's been one established in each parish, and all of these things. We haven't even touched these things yet. But the important question here to note is, for all of the people saying that enough is not being done, even with everything that we have discussed, if there was a possibility for the Ministry of Health or government to do more, what would that more be?
My answer to that is, listen, the Ministry of Health is the lead agency. This needs and requires the partnership of every single responsible person in the country. It is needless, in my view, to sit and say, you're not doing enough, you're not doing enough. We cannot, and as I said during the mosquito outbreak in 16, the ministry is not able to go in every single backyard in this country and destroy your breeding sites. We're not, it's not it's physically impossible. So that it is incumbent on persons, organizations, leaders to do what you can in your neck of the woods, right? To help do the right things. In other words, teaching persons or reminding persons or making sure that persons wash their hands, clean your doors, clean your surfaces. When you cough, do the right thing. Those are the measures that needs to be heightened, and it's a responsibility of everyone. We are leading it to actually do if we want to minimize the impact of this current COVID-19 outbreak.
Right. Now, what's important to note, I believe, is that a lot of people with right to be concerned, because I think sometimes when I speak, people misunderstand coming from a place of concern for speaking facts.
Okay.
And I always lead my decision based on facts. What are the facts, and how can these facts contribute to the decision that I'm making? And I think people confuse that sometimes with a lack of concern. But, I mean, everybody has a right to be concerned, because this is something that hits really hard home for a lot of us. You know, a lot of us like myself, with sick family members who wonder, okay, if this thing hits our shores, how am I going to deal with the fact that I have members of my family that's sick? What am I going to do? You know, but at the same time, I have a responsibility to the people that listen to give them the facts and not to feed them my emotion or what I feel, you know, which is the responsibility that every Grenadian has, whether it's with a social media page or it's on WhatsApp or it's a radio program, a television program, a newspaper. It's your responsibility to your followers to not feed into their fears.
So, listen, you've touched a really, really crucial point here. One of the biggest challenges that we've had, and this current outbreak has had, is actually dealing with all of that hype, misinformation, lack of facts that persons are, out of concern or otherwise have put out there. And I think, quite frankly, it is maybe one of the biggest challenges that public health has had in this outbreak to combat, to fight against, to try and clarify, to try and have the right information out there. This is one of the biggest challenges. The challenge, like I think one of my colleagues quoted Mayor Andrew Cuomo, is that the mayor of New York? When he said a couple of days ago, I may not be able to paraphrase him, 100%, but he says that the current epidemic is caused by the coronavirus, but the pandemic, real pandemic, is caused by fear, and it has been driven by all of those that information that we don't know about, and so we have a responsibility, as you say, that let's get out there the facts about this current outbreak and not just, putting things out there that you don't, that you cannot validate. So we have a responsibility. The media, and, there was a press conference last week, and I was pleasantly surprised that, the coverage and the spin of what happened there was positively done, because I did ask that and mention that there is a responsibility that we have to our fellow men, our fellow citizens, to get the facts straight, to get the information right, so that we can holistically minimize the impact of this current epidemic.
I want to touch on just one more thing, and that has to do with finance. And I know for a lot of people, it's a touchy situation because it kind of feeds into their emotion as well. And it has been said that this government is only interested in the economic side of the situation as opposed to dealing with the fears of the people. And I tend to disagree a lot with people on that, simply because the fact of the matter is, after this coronavirus is gone, the country still has to move forward. Now, if we are in a place, and we will come to a place where we'll see shortages, because we're looking at an international community who is shutting down millions of people and shutting down provinces, and you will find that there will be shortages we are a net import country.
Correct.
So we are going to find that there are shortages, and I think these are the things that we need to focus on. These further steps. What do I do in the event? And we're looking at now the United States dealing with this issue where they've now seen community transmissions, where the virus is being spread, not widespread, but to close contacts within communities. And that is one of the biggest fears in this situation.
Yeah, I mean, every outbreak would have its economic impact, negatively so. This one, with the fear that it has generated, is going to have more. I go back to CHICV, the numbers when it was calculated for sick leave, etc., was a humongous amount of persons who stayed home, who got sick, and productivity was affected. This virus is going to basically have that impact as well, a negative impact.
Right.
Hence the importance, and I keep reiterating, hence the importance that we boost our immune systems. We are in the best health. We try as much as possible to do the right things in terms of trying to minimize transmission, so that we don't get sick and thus sort of like become unproductive.
So if we shut down our country, it means that we are not gaining any revenue, which means that the cost of maintaining one person.
Oh, so you're doing it.
I have to. I mean, my mind is always going.
Right,
so
right,
from
right,
the time
right.
you mentioned that we're
Yep.
looking at. And then we have to look at the cost of testing. We have to look at the cost of ensuring that we continue to get medication. We continue to get the gear that our health officials
The
need.
world is going to go on, so we just have to
Yeah.
minimize
And-
the impact. The conversation about what is being put into it money-wise, as opposed to, I am not sure where that is coming from. I think at the moment, I have been told that whatever you want, once it's available, that the government will
course.
support it.
Of
That's what
course.
I've been told. I don't have the check in my pocket, mind you. But, I've been told that, if we're going to be ordering as many ventilators as we can, working the models,
Right.
and it's going to be, in other words, there's going to be a positive feedback or spin-off.
For our
Because
healthcare system, of
yes,
course.
yes, because corona is going to come and go like every other epidemic
Yeah.
has, and we're going to be, I'm looking at the positive side of what is happening here.
Right. So I just need people to understand that it sounds good theoretically to shut down the borders, but when you look at it in a practical sense, it really doesn't make much sense, because we have to look at the cost of maintaining quarantines. the
Everything
cost-
else you do,
Yeah.
everything else that is being done.
And of course, let's talk PCR machine, because we know, and I know you have to leave, so this is going to be the last.
Okay.
PCR machines. That's
Yeah.
the machine that we're going to be using to do on-island testing for the
Right.
coronavirus. Where are we at right now with
That-
acquiring it?
That machine has been ordered.
Right.
If I come on national radio or international radio and say, Miss Duncan, it's going to be here on Friday, I'll be telling a big lie,
Right.
right?
But we know it's on
Oh,
its way.
definitely on its way. And it's going to be packaged, meaning that training will come with it. For our practitioners here, we have already identified the persons who have the ability to do that kind of training,
Right.
including private sector lab techs as we
Right.
speak.
Okay.
I personally reached out to a couple of them, and they have agreed. So we're not going to be only training our in-house persons, but persons outside, on the outside. And the PCR machine, as I said, we're going to be acquiring one, and it's not going to be for COVID only. There's going to
Right.
be other things. So in other words, we're actually boosting up our healthcare infrastructure as we speak.
All right. You have provided us with so much information. I really thought that this was necessary, because we spend a lot of time trying to refute the negatives, that the positive message gets lost in between. And I think it was important for us to sit and just go through the structure, go through the process, go through the procedure, so that we know what is happening, and that we know that we're doing all that we can financially, with manpower, with screening capabilities, with our housing for our sick people, caring for our elderly, and the message that we still always want to put out there is that we must always all do our part, follow the right processes. And if you know of a shut-in in your area
Yeah.
that has underlying conditions, that may be sick, it's the advice of the Ministry of Health, if I may
Yep.
say, to
Yes, that's correct.
contact the
Healthcare
health
facility
center
in your area
and let
for them
know.
to arrange a visit. I want to thank you for the opportunity to share what the ministry is doing, what the government is doing. The 5-point strategic plan covers, the whole response, and every day we're looking to build on it. It is not, and nothing that I know is perfect except for, the one above, and we're looking to persons to take on their responsibility in their neck of the woods, as well as we all together, as we have this national response to the COVID virus led by the Ministry of Health.
All right. Well, thank you so much, Doctor, for coming. I hope, of course, we have the opportunity to sit again as this progresses. Like they say, the response of a country must be tailored to
This situation.
their situation. So
Okay.
thank you so much for joining us.
You're most welcome.
I know they say no shake hands, but I could get a fist bump.
Yes, of course.
Thank you so
Okay,
much.
bye-bye.
For being
Nice
here with
being
us.
here. Bye-bye.
Guys, so you heard it from the doctor himself. I mean, the information is there. It's just how we choose to receive that information. That is what makes the difference. All right. So we have a call on the line. I'm going to take this call right now while the doctor takes his leave. All right. Good morning, caller.
I'm Pinky. Hold on, please. Hold on, Pinky. I'm on another call. Hello. Good
Hi.
morning. Good morning.
Good morning.
Yeah, how do you do?
I'm good. How are you?
Yeah, not so bad. I've been listening for the longest while, you know. I've listened to Dr. Mitchell, as I would have listened to him in the past, and Dr. Martin and all the Minister of Health and other health officials. But,
Right.
you know, I don't even know how to start. Sometimes I feel rather disturbed, and I don't want to say emotional, but, you know, in terms of the comments and the utterances that come from our people's place. Just give me a minute. Let me just turn on the phone, please. Yes. Yes, as I was saying. Yes, sorry.
And
Yes.
I don't want to cut you short, caller, but we are pressed for time and there are other calls on the line. So could you keep the comment brief?
Yes, I'll keep it
Thank
brief.
you.
Yes, so I was listening to our program this morning, and despite the information that we have been provided with, right, in terms of what we can do to help protect ourselves and to contain the spread, people just continue to spread misinformation, you know? And sometimes some of these so-called radio hosts are allowing people to get away with just spreading misinformation. And if we do not trust the information that we have been given by our own health officials and our people in authority, they could easily go to the website, to the CDC or the World Health Organization and get and verify the information. So I'm
Yeah.
saying to us that we have a responsibility. We should not be just blaming everybody for everything. And a lot of the things that our people are asking for is just not practical. Even the so-called developer first world, could they have quarantine throughout the country? Could they provide everything that the people are asking for? We in Grenada here have to be just practical and be real. I mean, come on. We have to stop this nonsense and do what we have to do to let us hope in the first place that it doesn't enter. But there is, the possibility is slim. There's a great possibility that the virus might enter at some time. But when Dr. Mitchell spoke about, for example, this morning about the further measures, like in terms of the port entries, right? So it's only 2 entries for the yachts, for example. There are the one in Carriacou, one in Carriacou and one on the mainland. I mean, all these are measures that the government are continuing to take to prevent ourselves from getting infected and for the virus to be spread to the extent that it would create an emergency, for us and so on. So again, the final appeal is that our people have to be more responsible. We ought to do better than that. Thank you.
All right, thank you so much for your contribution, caller. And he's absolutely right. We have to be more responsible as a people in the information that we share. I mean, the story has never changed from the beginning. It's just what we choose to listen to. And sometimes it can be to our own detriment. So we spend so much time trying to refute comments and trying to clear up misinformations. And I think we've spent the past 2 weeks trying to do that we've lost the process, that we've lost the good, that we've lost the measures being put in place in all of that commotion. And it's good to just sit back for a moment and just listen, and take in what is happening, understand what is happening, So we have, based on what the doctor has said, so many measures in place. We have to come now to the realization that this is an eventuality. The question is no longer how it's going to get to our region. The question is when. We're doing all we can here in Grenada, but there are countries in the region who are not taking these stringent measures. What do we do then? We cannot make them do it. But what we can do is prepare ourselves, prepare our country. So as the doctor said, if you know of somebody within your community, within your neighborhood, your village, your constituency, a shut-in, a sick, an elderly person, report that person to the health center so that they know in the onset of this infection, this infectious disease, they know who to pay attention to. They know who are sick are, who are shut in are, who are elderly are in the community. That's our duty as Grenadians. That's what you are being asked to do. This must be a collective response. We must all agree that we have to work together. Because if I agree and you don't agree, then I'm still as exposed as if I don't agree. You know? So we all have to do a part. We all have to pay attention. Listen to what is being said to you by our health officials. Listen. You're asking the government to shut down the borders, but you are not taking into consideration the people whose livelihood depend on this means or this source. You're also taking into consideration that you are cutting out a supply or one of our main supplies of revenue, which means that the $9,000 that they spend on each individual quarantined person, where is that money going to come from? You know, y'all don't want to hear about the money. Y'all think the government is only thinking about the money, but you have to, because after this is all said and done, the country must live on. We must live on. And then we'll be picking up the pieces of a bankrupt country simply because the government acted on the fears of the people and did not make prudent decisions to benefit the country in general. So I know that we are scared. I know that we are concerned. I know that we're afraid. And a lot of people say, oh, you're not concerned and you're not afraid. But if I am afraid and you are afraid and we all are afraid, what purpose is that serving? What benefit is that to fixing this already troubling situation? What comfort is that giving to our children who will also be affected? To our elderly who will be affected as well? To our shut-ins who will also be affected? What comfort are we giving to them? Because like I said from the very beginning, some of us may not even die as a result of the virus, but the fear that is being passed on may very well be the demise of some of us. So we have to be careful. We have to be responsible as a people. You know? As afraid as I may be, I can't come and sit here and say, well, oh, you be afraid, be concerned, you know? I can't come here and sit and say, well, I ain't fine. This person doing enough. There must be a voice of calm in the midst of all of this adversity. We have to remain positive, as my good friend is saying in the chat. We have to be mindful of the information that we allow to be spread, because you may not publish something that is misinformation, but you may be just as guilty as the person by spreading it without verifying if it's true or not. Let's all do our part. Let's all play our role. You know? Start thinking ahead. Start thinking of the repercussions of this virus. What is going to happen to our import market? What is going to happen around the world as it relates to shortages? Are you prepared as a household in the event that there is a shortage? Have you put a plan in place for your household? All of these things you must consider before you run around pointing fingers. We must be mindful of all of these things. So I appeal to you today. Let us move away from the fear. We've spent almost a month saying all sorts of negative things about each other, about our government, about our health officials. We've spent weeks poking holes in their stories, trying to find a way to say that they're wrong, or that they're lying, or that nothing is being done, or that we're not prepared. We have spent weeks spreading mistruths, reproducing misleading stories. Let us put that behind and let us spend the upcoming weeks preparing ourselves, preparing our household, preparing our children, preparing our communities, sharing information. Let us prepare. And that's all I have to say to you this morning. Guys, it's always a pleasure speaking with you. So in whatever you say and whatever you do, be safe, be secure. I always want to be talking with you and never about you. Enjoy the remainder of your day.
COVID-19 spreads from person to person through the droplets that are produced when someone coughs or sneezes, which makes it easy to spread between people in close contact. Now let's get prepared to stay healthy.
To reduce your chance of catching or spreading COVID-19, practice these simple everyday preventative measures. Droplets can also land on surfaces, so ensure that you wash your hands frequently for a minimum of 20 seconds or sing the happy birthday song twice. Avoid touching your face, especially your eyes, nose, and mouth. If soap and water are not readily available, use an alcohol-based hand sanitizer with an alcohol content between 60 and 90%. 70% is ideal.
When you cough or sneeze, cover your nose and mouth with a flexed elbow or a tissue. Dispose of the tissue immediately and then wash your hands. If you notice someone has a fever and cough or other symptoms of respiratory illness, avoid close contact when possible. Let's all do our part to ensure that each and every Grenadian remains healthy. Our health is our collective responsibility.
Ministers and permanent secretaries working to improve implementation of major cabinet decisions. We'll have details to this story and more in the national report. With the details to the news for Friday, March 6, 2020, I am Rikisha St. Louis. Government ministers and permanent secretaries spent the day on Friday brainstorming ways as a team they can strengthen and improve the rate of implementation to boost the public sector and economic development. Prime Minister Dr. the Right Honorable Keith Mitchell says an implementation deficit continues to plague government. He says for months projects have been in the pipeline, funds have been secured, and they were not implemented.
We cannot allow implementation deficit to continue to plague our government. This term, implementation deficit, which describes a lack of decisive action in introducing proposed measures for the express purpose of addressing obvious shortcomings in the economy and the society cannot be part of the legacy we all live for the future of our country.
Dr. Mitchell stressed the importance of teamwork. He challenged the ministers and their respective permanent secretaries to build trust and better working relationships, which will trigger successes in achieving the country's development goals.
It has proven that countries or organizations with a high level of trust and good relationships at the administrative level and management levels have had the most success in the implementation of policies. Colleagues, it irks me and frustrates me when I see so many important opportunities as projects that affects the livelihood of our people are held up for no other reason sometimes is our own egos. Not necessarily the lack of resources. So many times things seem not to move, get stuck.
Cabinet Secretary Mrs. Ruth Rouse says government has been on the development path for years now, with the establishment of the medium-term agenda and the National Sustainable Development Plan. Ms. Rouse explained that at the end of the workshop, each ministry will be expected to implement an action plan, which will be supervised by the Cabinet Secretariat.
Towards the end of the day, you will be asking your ministry teams to develop an action plan with 2 or 3 game-changing steps that you will partner to implement within a specified time frame. This is a critical piece in ensuring the sustainability of the gains of this workshop. We cannot drop the ball on this one. The Cabinet Office accepts responsibility for monitoring the implementation of the action plans and transmitting reports to Cabinet and the Senior Managers Board.
Diplomats visiting Grenada this week have commended the actions being taken at the ports of entry to help prevent the introduction of the novel coronavirus COVID-19 to the country. Although they represented different countries and institutions and had separate meetings with the Prime Minister, the diplomats seemed to share a unanimous view that when they spoke of the health screening and surveillance measures being implemented in Grenada. Pan American Health Organization and World Health Organization representative to Barbados and the Eastern Caribbean countries, Dr. Itades Gibre, head of the delegation of the European Union to Barbados, the Eastern Caribbean states, OECS Carriacou and CARIFORUM Ambassador Daniela Tramaser, and Ambassador for the Federal Republic of Germany, Mrs. Ute Kognig, all confirmed having to go through the requisite screening at the port of entry. The diplomats detailed the screening process they went through on arrival at the Morris Bishop International Airport and commended the frontline staff for maintaining established procedures regardless of the stature of the visitor. The visiting officials said they were impressed with the measures, and the fact that diplomats are also being screened illustrates that the proper due diligence is being done. They also commended Prime Minister Dr. the Right Honorable Keith Mitchell for his leadership on the matter, and he in turn acknowledged the role of the Ministry of Health and other frontline staff for the effectiveness of the measures implemented thus far and for keeping the public abreast of related developments. Dr. Mitchell assured the visiting diplomats that Grenada will continue to be proactive in the fight against COVID-19 and pledge the country's ongoing commitment to work with regional and international partners in this effort. The Prime Minister is also demonstrating leadership through his actions and has instituted a no-handshake policy in keeping with the advice of health experts to use a different form of greeting as part of efforts to prevent the spread of the virus. This is the National Report. We'll have more news after the break.
Grenada's #1 track and field event is back. The Inter-Secondary School Championships is back at the Carriacou James Athletic Stadium. You must be there. Experience the intense rivalry between athletes of our secondary schools on the track and in the field. Blame yourself if you missed the first ever Republic Bank sponsored Intercall 2020. Blame yourself if you miss a day of exciting action on the track. Be there every day, day 1, 2, and 3. The 53rd Intercall Championships takes place on March 31st, April 1st, and 2nd, starting at 9 a.m. each day. Come, let's celebrate the inaugural Republic Bank Intercall. Come out families, come out past students, come out school-based supporters for the return of competition on the track and in the field, because Intercall is back.
Welcome back. Eliminating all modes of violence against women and girls by 2030 is the main aim of the Spotlight Initiative, which saw the signing of the Grenada Country Program on Thursday. 2.2 million euros will be invested into the program as Grenada joins with other countries to eradicate the problem of violence. Minister for Social Development Honorable Delma Thomas expressed her appreciation for the investment by the European Union.
As the Ministry of Social Development, as the government of Grenada, we want to thank the UN system for continue to believing in us, for continue to assisting us. We know that apart from the Spotlight Initiative, Dr. Allies, we know that other funding will be coming our way, and we will be working to capture those funding as a ministry to ensure that we protect children and we protect our people. So we look forward to implementation of the Spotlight Initiative, and we look forward to continue working to eradicate gender-based violence among our people.
Her Excellency Daniela Tramaser, head of the delegation of the European Union to Barbados, says that the initiative is of crucial importance to Grenada.
We believe that the human rights are our fundamentals. The defense of human rights are our fundamentals of our society, in what we believe. And the European Union has two big beliefs. One is peace, security, human rights, and the fact that we are all on this world planet to work together. That's why we defend, and we will always defend, multilateralism, the fight against climate change, the fact that we have to remind ourselves that as human beings, we can't close our eyes.
She thanks the government for their commitment on a global basis to ensure that the target is met.
I want to particularly thank the government of Grenada. You are our knight in the OECS to spread the word on this. Not the fight, not the violent fight, the peaceful fight.
Finally, in the news, finalists for the Grenada National Wear Competition now have a May 4th deadline to present the finished product of their design to a panel of judges. 16 designers have submitted 22 designs of male casual and formal wear and female casual and formal wear. 5 finalists on Tuesday were presented with funding to complete the designs. 1,000 EC dollars was presented to Jamela Douglas, Talisha Alexander, Vanell Coffey, Tamara Prosper, Duro Jarrell Langine Sampson, and Mary Joseph.
The national wear is extremely important. We have the Olympics coming up. We have swimming competition. We have beauty competition out there. All these things are taking place. You have Dubai coming up in 2021. And Grenada will showcase its national wear in most, and not if not all of these events.
That was CEO of the Cultural Foundation, Ms. Shoma Wells. The general public will also have a say in the final selection.
On the way forward, they have been given 2 months, which will take them to the 4th of May to produce the garments. As of the month of April, we will be positioning the designs throughout the parishes so that the public can vote in on which one they would like to see as the final one, because it is important that the public has a buy-in on what they're going to wear as the national wear. So in each parish, we will be putting up posters
also including Carriacou and Petit Martinique.
A total of $23,000 in prize money will be allocated to the first, second, and third place winners. This is the national report for today, Friday, March 6th. Let's recap the top story. Ministers and permanent secretaries working to improve implementation of major cabinet decisions. On behalf of the entire news team here at the Government Information Service, I am Rikisha St. Louis saying thank you for joining us. Until next time.